Our bodies are intricate, interconnected systems, where each part plays a vital role in our overall well-being. Think of it as a finely tuned orchestra, with every instrument contributing to a beautiful symphony of health. Among the most hard-working yet often overlooked musicians in this orchestra are our kidneys. These two bean-shaped powerhouses, each about the size of a fist, are our body's master chemists. Day and night they perform a remarkable feat of purification. They tirelessly filter about half a cup of blood every single minute, which adds up to nearly 200 quarts a day. From this, they meticulously remove waste products and excess fluid, which then become urine. But their job doesn't stop there. They precisely balance the body's levels of salt, potassium, and acids. This delicate equilibrium is essential for your nerves, muscles, and other tissues to function correctly. They also act as a hormone factory, producing renin to help regulate blood pressure, erythropoietin to signal the production of red blood cells, and an active form of vitamin D, which is crucial for absorbing calcium and keeping our bones strong. As the years advance, it's natural for this sophisticated filtration system to show some signs of wear. The number of filtering units can slowly decrease, and the blood vessels supplying the kidneys can harden. This means that with age comes a higher risk of developing kidney-related issues. A concerning aspect of this is that the decline often happens silently, without any obvious symptoms in the beginning. Because of this quiet progression, many older adults may not even be aware that their kidney function is diminishing. But there is good news. With greater awareness and simple, proactive steps, we can support our kidneys as they age, helping to prevent small problems from escalating into more serious conditions. Understanding how they work is the first step toward protecting them for years to come. As we journey through life, several factors can converge, placing our kidneys under increasing strain. It's not one single thing, but rather a combination of natural changes and accumulated health challenges that make them more vulnerable. Understanding these factors is the first step toward protecting these vital organs. First, there's the natural, gradual decline in filtering capacity. After about age 40, the estimated glomerular filtration rate, or eGFR, tends to decrease by about 1 point each year. While this slow decline is a normal part of aging, a faster drop can signal underlying kidney disease, not just the passage of time. This reduces the kidney's reserve capacity, making it harder to handle stress. Consequently, the kidneys bounce back less easily from injury. An illness with a high fever, a bout of diarrhea, or even certain medical procedures can cause a temporary dip in kidney function that a younger person would recover from quickly. In an older adult, this can sometimes lead to more lasting damage. Chronic health conditions are also major contributors. Conditions like hypertension, type 2 diabetes, and heart failure are the leading drivers of kidney damage in older adults. High blood pressure relentlessly pounds the delicate blood vessels inside the kidneys, causing scarring. Meanwhile, high blood glucose from diabetes forces the kidneys to work overtime, eventually injuring the tiny filtering units. Heart failure can reduce blood flow to the kidneys, starving them of the oxygen they need to function properly. The sheer number of medications many older adults take, a situation known as polypharmacy, also poses a risk. Some common over-the-counter drugs like NSAID pain relievers, as well as certain antibiotics, diuretics, or even contrast dyes used for CT scans, can be tough on the kidneys. It's crucial to always inform your doctor about all medications and supplements you're taking before any new prescription or procedure. Finally, dehydration becomes a more significant threat. A reduced sense of thirst, mobility issues that make getting a drink difficult, or even a fear of needing the bathroom at night can lead to chronic low-level dehydration. For example, someone might avoid drinking water after dinner to prevent waking up, not realizing the impact. Even mild, repeated dehydration concentrates the blood and reduces blood flow to the kidneys, increasing the risk of acute injury and accelerating long-term damage. Other issues, like urinary blockages from an enlarged prostate or recurrent urinary tract infections, can also allow pressure or infection to back up into the kidneys, causing lasting harm if not addressed promptly. Because early-stage kidney disease is often called a silent condition, many people feel perfectly fine while their body is quietly working overtime to compensate for declining function. Your kidneys are remarkable at adapting, but they can only do so for so long. That's why learning to recognize the body's subtle whispers is one of the most powerful things you can do. Let's walk through 8 of these quiet signs. First, changes in urination. This might mean needing to get up to urinate more frequently at night, or conversely, noticing you're going much less than usual. If you notice a consistent change, try keeping a simple log for a few days to share with your doctor. Second, the appearance of your urine. If it consistently looks foamy or bubbly, that can indicate protein is leaking out, a key sign of kidney filter damage. It might also appear darker or tinged with blood. Mention this change to your clinician. A simple urine test can provide answers. Third, persistent fatigue. When kidneys don't filter well, toxins build up. They also produce a hormone that helps make red blood cells, so poor function can lead to anemia, causing profound weakness and tiredness that rest doesn't fix. Don't just dismiss this as getting older. Ask for a blood test to check. Fourth, mental fog. That same toxin buildup can affect the brain, leading to trouble concentrating, memory lapses, or dizziness. If you or a loved one is experiencing new confusion, it's important to seek medical advice promptly. Fifth, swelling, also known as edema. Damaged kidneys struggle to remove excess sodium and fluid, which can accumulate in your feet, ankles, or legs. You might also notice puffiness around your eyes in the morning. New or worsening swelling always warrants a call to your doctor's office. Sixth, a poor appetite or a metallic taste in your mouth. As waste products accumulate in the blood, it can make food taste different and suppress your desire to eat, sometimes leading to unintended weight loss. If your appetite has vanished for more than a few days, it's worth discussing. Seventh, shortness of breath. This can happen for 2 reasons related to kidney trouble: extra fluid building up in the lungs, or anemia, a shortage of oxygen-carrying red blood cells. If this happens suddenly, or with chest pain, seek emergency care immediately. And finally, number 8, persistent dry, itchy skin or muscle cramps. When kidneys can't maintain the right balance of minerals and nutrients in your blood, it can manifest as severe itching or painful leg cramps, especially at night. Over-the-counter creams may not be enough. Let your doctor know so they can check your blood mineral levels. Recognizing any of these whispers is the first step. It doesn't mean you definitely have kidney disease, but it does mean it's time for a conversation with your healthcare provider to get the answers you need. Doctors start with history, family risks, and current symptoms. A blood creatinine test leads to your eGFR, the best single indicator of kidney function. 60 or higher is generally normal. Below 60 for 3 months suggests chronic disease. Urinalysis checks for protein, albumin. Albuminuria can appear before eGFR falls. Red or white cells may signal infection, stones, or urinary problems. Blood pressure is always checked. Ultrasound can assess size, cysts, tumors, or stones without radiation. Together, results reveal causes and guide a personalized plan. Ongoing monitoring protects function and your overall health. Early detection empowers earlier, more effective treatment. Controlling blood pressure is paramount. Take your blood pressure medications exactly as prescribed. Track home readings and share them with your doctor. If you have diabetes, keep glucose in target with meds, insulin, and diet. Reduce sodium to lower blood pressure and swelling. Your stage may require limits on protein, potassium, or phosphorus. Stay hydrated, unless your clinician sets limits. Be active daily to support blood pressure, weight, and heart health. Review all meds and supplements. Avoid NSAIDs like ibuprofen and naproxen. Always check kidney safety before starting anything new. Caregivers help navigate plans and daily tasks, Organize meds, set reminders, and refill on time. Watch for swelling, fatigue, or confusion and report changes early. Support nutrition, fluids, activity, and glucose (BP) checks. Your steps: 1. Know your risks. 2. Watch symptoms. 3. Get eGFR and urine tests. 4. Control BP and glucose. 5. Be medication smart. 6. Live low salt, hydrated, active. 7. Keep every follow-up. Be proactive. Ask, how are my kidneys doing? Subscribe, comment your questions, and share this video to help someone today.